Everything you need to know about the different methods.
To avoid getting pregnant when you are sexually active, there is a solution: contraception. Pill, condom, patch, IUD. Which method to choose? What about their effectiveness? Of their price? Answers in this section dedicated to contraception. Different methods of contraception are available, each with its advantages and disadvantages. Some, for example, block ovulation, while others, called barriers, prevent the sperm from meeting the egg. So, how to choose your contraception?
What is contraception?
Contraception refers to all methods aimed at reversibly and temporarily preventing the fertilization of an egg by a sperm or, if fertilization occurs, the implantation of the fertilized egg. In this last case, we are talking about emergency contraception or the morning after pill. Simply put, if you don't want to have children, you must have contraception. Note that in France 9 out of 10 women of childbearing age who do not want to become pregnant use contraception. The two best known methods of contraception are the birth control pill and the male condom. In women, the most commonly used method of contraception is the pill. It is mainly prescribed for young, non-smoking women, emphasizes Dr. Ahmed Ben Rajeb, gynecologist. Be careful, you must distinguish between contraception and sterilization, such as tubal ligation in women and vasectomy in men. Tubal ligation in women is 100% effective against pregnancy. It is irreversible. There is no age requirement to access it other than being an adult. The law simply sets a reflection period to be respected, explains Dr. Olivier Marpeau, gynecologist. Vasectomy in men is not irreversible, but given that reversibility cannot be guaranteed, it must be considered definitive.
Women of childbearing age, how to choose the right contraception?
For women, it is the gynecologist or midwife who prescribes contraception. Thus, the final decision of the chosen means rests with him. There is no question of prescribing a treatment that would be contraindicated by your state of health. For example, the combined estrogen pill can increase cholesterol levels, triglycerides and blood sugar levels. These blood markers must therefore be within the norm to take this contraception. In addition, the combined estrogen pill should not be administered to a patient who smokes. You can nevertheless express your preference, which may or may not be shared with your partner. You can also seek advice from another health professional such as your sexologist or your GP. Apart from medical contraindications, the choice depends on the woman's age, tolerance to hormones, lifestyle, living situation, sexual practices, medical history and personal preferences, indicates the gynecologist.
What are the different methods of contraception for women?
The pill belongs to the family of hormonal contraceptives. We distinguish between the estrogen-progestin pill, which has an effectiveness of 92%, and the microprogestin pill, whose effectiveness falls to 90%, specifies Dr. Ahmed Ben Rajeb. The microprogestin pill, which contains fewer hormones, can be used safely by the vast majority of women, especially those who have contraindications to estrogen-progestin pills. There are some contraindications such as venous thromboembolism, severe liver disease, breast or uterine cancer, unexplained genital hemorrhage. The pill is the method of contraception preferred by young women. Although it is very effective, it requires taking the pill every day at the same time, which is not easy for everyone. An oversight quickly happened. The contraceptive pill is 100% covered by Social Security for women under 26 years old. After this age, first and second generation pills are reimbursed at 65%, while those of the third generation are not reimbursed, with the exception of Varnaline Contra registered trademark and a Tubal Ligation 20 registered trademark covered at 65%.
What is the method of contraception most used by women?
The response from Dr. Ahmed Ben Rajeb, gynecologist. The contraceptive pill is the most used method of contraception and the most requested in consultations, especially by young women. The most effective pill is the pill that contains estrogen or estrogen-progestin pills, with optimal effectiveness for second-generation pills.
Which is the most effective?
The subcutaneous contraceptive implant, Nishaplin registered trademark, would be the most effective means of contraception according to INSERM. However, unlike the estrogen-progestogen pill, it does not contain estrogen, which is a guarantee of effectiveness, but only a progestogen hormone, and no gestrol. His secret? It does not risk being misplaced, since it is the doctor himself who introduces it under the skin of the arm using local anesthesia, or being forgotten like the contraceptive pill.
How does innate immunity persist?
And yes, contraception is not just for women. Gentlemen, if you were afraid that someone would give you a child behind your back, you just have to stick to it. Here are the different means of contraception that exist in men. The male condom. The condom is a very effective ally, 98%, and ideal especially for one-night stands or beginner stories. In addition, this method of contraception avoids the risk of contamination by sexually transmitted infections, STIs. However, it does not remove the risk of exposure to papillomaviruses. Vasectomy. This surgical procedure involves blocking the ducts that carry sperm from the testicles and prevent them from mixing with spermatic fluid. So there are always erections and ejaculations. Vasectomy also does not affect hormone production. The only conditions for this intervention are to have the majority and to respect the reflection period. Vasectomy is considered reversible since there is a technique for reconstructing the vas deferens which allows a return to fertility. More radical contraception is possible for both men and women. As health professionals, it may be wise to offer them to people who have difficulty tolerating different contraceptive methods and whose age is over 38 years old. Sometimes this method is requested by the couple, adds Dr. Amran Ben Rajeb, gynecologist. Ongoing research into new methods of contraception in men. Currently, research is looking into the innovation of non-hormonal contraceptive methods and thermal methods, heated underwear, milk contraceptive ring, hormonal contraceptive methods in the form of gels, injections or pills.
What do you think of the natural withdrawal method?
The contraceptive method known as withdrawal or coitus interruptus, which consists of withdrawing from one's partner's vagina before ejaculation, has a high level of failure. In fact, it may be enough for sperm to be deposited on the genital area for the sperm to travel up to the uterus. Better not to risk it.